Yeah, so really appreciate you guys coming out. Will and I, a little bit about us, I guess. Obviously, we were chatting a little bit before, like we're two of the owners here at the movement. We have another business partner, Don, who's also part of the trio. But Will and I have been connected since physio school. So we met at Western. Unfortunately, we didn't go to McMaster, but McMaster is actually the only place that declined me entry into physiotherapy school. So, but we met in physio school in 2016. And throughout that kind of journey, we started like a podcast and we started an Instagram page, and we've really kind of like dove into, the profession and trying to do what we can to like move the profession forward and have an impact. And that kind of led us to a mentorship, which is like part of what we're going to take you guys through today is one small subsection of a mentorship that we run. For students, well, more for new grads and clinicians who've been out probably closer to 5 years. But this section, I think, is going to be something that's really important for you guys as like either like a new student, like first year, or just about to go into practice. We're going to talk about the idea of imposter syndrome and how you guys can manage it or overcome it as you move into your careers, because we know it's definitely something that you've probably heard about before. Maybe you've experienced it a little bit. So we're going to dive into what imposter syndrome is, how we think it gets created, and then we're going to take you guys through a step-by-step process of how you can manage this yourself. So we will do a little bit of work today, not too much, but we'll do a little bit. So
7 o'clock at night, anybody?
Yeah. In physio school, Will and I would definitely be having a coffee right now, but as adults now, I guess, we can't. But coffee's a big part of what we do. We love it. And so it's kind of in everything. So
we used to just get together and like rant about physio and what was going on at school and everything. And that kind of coincided with our growing love of coffee. So that's where this is all from.
Yeah. What I want to ask you guys, though, is what are some things that you think create imposter syndrome, or have you experienced some type of imposter syndrome yourself now that you're starting to get into placement, or maybe you're about to go on placement? What are some things that you guys have experienced? And just feel free to throw out some thoughts or feelings.
No need to be nervous about it because both of us dealt with it. And probably occasionally deal with it now still, so.
Yeah.
I think when your expectations don't match the reality, or when you've learned so much theory and then you go to apply it, or like, I don't care about everything, just fix this problem for me. And then you have the question of like, how do I integrate the skills I've learned with what people actually want versus the goals and the management plans I have.
Yep, that's a good one for sure.
Comparing with other students in our class for sure, that's one way to get imposter syndrome.
Yeah, in what way? Like comparing in what sense?
Maybe just comparing in terms of like their knowledge or experience.
Yeah.
More they know than me.
Right. Yeah, that is definitely something that you can get caught up with for sure. Yeah. Anyone else have any thoughts?
For me, I think like running into things that I've never seen before, haven't even learned about, because they can like cover so much in school. You like run into something, you're like, what do I even do? Like, where do I even start? Like, I've been through all the school and I still don't know what to do. Like, in those situations, that's where I feel it, I think.
Yeah.
I think for me, it's like thinking of starting practice and like people paying money to come see me. It's like, why are they going to come see me when they can go see someone who has 10 years experience or like taking all these courses and like just know more than I do? Like, why?
Yeah. That was something that I think I struggled with a lot too, is like accepting that people are like actually coming to pay me for a service.
Like, it's okay. Like,
You have the fallback of your preceptor. Yeah, you definitely don't have that. That makes sense.
You're worried that do you actually have the value that someone's looking for?
Yeah.
Just coming out of school or just being in school on placement. I think that's something that lots of people deal with.
For sure.
We both dealt with that.
Yeah.
Yeah.
So you guys nailed like a lot of things that we talk about here. Like, you can't believe your clients will listen to you or that they'll come to you for help. You think you need more knowledge to be successful, right? You feel like you're pretending to be a physio. Like sometimes I kind of felt like that at first, like the whole idea of, which I don't know if I necessarily agree with this statement anymore, but like fake it till you make it. I'm sure you guys have heard that before. So like there's a lot of those kind of feelings that like definitely happen, and it's definitely something that Will and I have experienced. And like the comparison game is something that I think happens a lot in physio school, especially when it comes to like courses, or should I be doing this person's doing all these different things and I'm not doing that, right? So it's very easy to get caught up in that game.
Yeah, I don't know what it's like with what you've all experienced, but when we were in school, it was like everybody was already planning what courses they were going to be taking when they got out of school.
Yeah.
Like, oh, I'm going to take this course, and then year 2 I'm going to do this, and you're like getting more and more stressed, like, oh, like I need all this stuff just to like be able to be a good physio.
I'm just trying to remember the ultrasound parameters so I can pass this exam and then never use ultrasound again. But yeah, so this is definitely something like we've all experienced, we've all been there, and we've experienced it, and it kind of got us thinking like, why does this happen, right? Like, why do we get imposter syndrome? What drives it? Where does it come from? And this kind of led us to like putting together this framework or this idea of why we think it happens. Now, like, we're not these super geniuses that invented this whole new framework, but it's talked a lot about in different industries, imposter syndrome, but we kind of put it into the realm of like physio. And like, we think a big driver of imposter syndrome is this idea that we're all trying to chase this super physio. So this physio that has all the answers, that has all the tools, that has all the, the courses that can fix any person that comes in. They have all the answers. They're never wrong, that kind of thing. We're chasing this person in order to be that super physio that can help everyone, right? What we slowly started to realize is that person actually doesn't exist, and you're chasing something that actually isn't real. And a lot of times what happens is except for this guy. This guy's definitely got all the answers. And what we've realized is like you come out and there's this massive gap that you've created between who you are and where you're at in this idea of a super physio that has all the answers that's going to be able to help everyone. And the bigger that gap is, the more imposter syndrome you're going to feel, right? What we found is that people will try to fill that gap and try to make themselves feel less like an imposter by taking all the courses, getting all the certifications, trying to find all these different tools to put in your toolbox to be able to be the super physio. And what we found is that actually ends up driving a lot more imposter syndrome, because now you just realize there's a lot more stuff that you actually don't know. And there's a lot of ways that you have to take these tools and try to implement them. You learn it in a course, but it's not necessarily relevant to what you're doing in practice. And then you start to question like, well, why should I be using this and how should I use it? And we realized that it was just kind of driving more imposter syndrome in people. And so we have created this idea of like, you guys are the super physio. Like, you are a super physio and you're going to create your own super physio. And we'll talk about how we'll do that. But before we dive into that, Will's going to touch on another aspect of this that I think really leads to imposter syndrome for clinicians.
Just quickly before I go into that, like Kendra, you kind of mentioned, it's like you come across something and you're like, I've never seen this. I have no idea. And I think something that we kind of get caught up in is we have this idea that someone else does know. They know all the perfect exact thing that's going on, or the exact like set of exercises or whatever treatment that you're doing that's going to like help that person and get them 100% better. And I think the reality is that's probably not true, and there's probably a lot of right answers and some things we'll get into later that can help like maybe give you some more clarity in a different way that's not like just knowing everything. And that's kind of what this is about, right? It's sort of, and I'm sure you've all started to realize it's sort of insurmountable to know everything. But the reality is you do know a lot. Like, how many years who's been in school for more than 4 years here? Everybody, right? Like, so for the most part, like when compared to general population, you know a lot, about the human body, about pain, biomechanics, yada, 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 right? Like, you're not, here on this chart. Has anyone seen this before or heard of this, right? So at the beginning, you're like, know everything. I'm in physio school, right? Like, prancing along, and it's like this ignorance is a bliss, right? And then you start learning, and you're like, crap. Like, there's all this stuff that I don't know, right? And what we're trying to say is to make that jump, you don't actually need to learn any more physio things. Obviously, I'm not saying don't learn any more physio things, but what you're dealing with is not being competent in that uncertainty. And so that's where you can really become more competent and without even learning another special test or anything. And we're going to kind of go through with some of the exercises that we're going to do today is understanding, like, when you know what you're trying to show up as and what values are important to you, you're going to realize, I can do that right now. And I can actually execute this really well, even though I don't know everything. And what we're saying about that super physio is that doesn't exist. We still don't know everything. We're still looking things up and, collaborating with each other. We don't know that much more than you guys do, right? But we're not necessarily experiencing as much of that imposter syndrome that we used to. Doesn't really correlate with having more knowledge.
Yeah, and a lot of what we found was like alignment with like who you are, how you want to show up as a clinician, what you believe in, what your values are, and making sure that you stay true to that as a clinician is very important to feeling less like an imposter. And then the other thing is like what we talk about in the mentorship as a whole is that there's a lot of like frameworks that we've created to help deliver the information that you guys are learning. Like, you learn a ton of information, but the hardest thing is like not like knowing how to assess someone or how to identify something. It's more like, how do I now take this information, put it into a plan, and make it easily digestible to a client? That's the challenging part. And like our mentorship talks more about that. So I think like alignment with who you want to be as a clinician, and then learning frameworks and ways to deliver the information that you guys are like taking in and putting together for clients are the two things that are really important to the success as clinicians. And we believe that like young clinicians like you guys coming out of school now can be very effective and help a lot more people than you think if you can manage those two things really well. A lot of things that we got told coming out of school was like, oh, it's going to take years to get the experience to be able to do this or to do that. Like, and not to discredit experience, there is some value to that, right? But I don't think it's as much of a thing that needs to, dictate how fast you can start helping people if you actually start taking control of like those two things.
Yeah, I forget who said it, but it was like something about how, you're explaining all these things to your client, but they're like, I don't really care. Can you get me better? Was that you?
Yeah.
Hassan? Yeah. So like, that's kind of what we're saying. It's like, it's the how do you help them visualize their success? Like, that's something that can really help you as a clinician. It's not necessarily like, here's this one exercise. It's like, how do you tie that to their goal with a plan that shows them, how you can help guide them to their future, right?
Yeah. So the idea with this is that you are the super physio, and you need to figure out what your values are as a clinician, what you stand for, what you believe in, how you want to show up, kind of what you want to do as a clinician. And once you identify those things, then you can go out and start taking courses that fulfill on what you align with. So a lot of our classmates coming out of school were like Will was saying, we're going to take all these courses, we're going to write because we just need more courses. But Will and I were like, I don't understand, like, why would we do that? Like, we just learned so much, and like, I don't even know why I want to take Mulligan 6 because like, I don't even know what that is, you know what I mean? Like, so we kind of went through this process ourselves and kind of over the years have refined it. And we're going to share a little bit with how you guys can create this, which is we're going to start off with like breaking out and having you guys work on a couple things, and then we'll talk about it. So the first thing we're going to start with is looking at your why. So you've probably heard this a lot. It's not like we're the first people to be like, find your why or identify your why, but we really believe like figuring out what your why is as a clinician or as a person is very important to driving forward like your career. And so the very first step in this process is to identify your why, and we have you guys go through this 5 whys deep drill. So essentially what it would be like, okay, what is your why for wanting to be a physio? You're going to be like, well, I want to help people feel better. Then you say, okay, well, why do you want to help people feel better? Well, I want to help people feel better because when I was younger, a physio helped me and it allowed me to play sports. It's like, well, why is that important? And you keep kind of diving deeper and deeper to find like what the deeper why is as to what you do. And the more personal and deeper and meaningful you can make it, the better it's going to be, you know, for you as you move through your career. Now, the important thing to remember is like this is going to develop probably over time as you guys move into the profession. Today, you're not going to find this like, maybe you will, but you're not going to find like this beautiful why if you haven't thought about it, but it's going to get the process started. So we're going to start with that. We have some paper. We're going to have you guys take about 5 to 10 minutes-ish. Think about your why and try to do like the 5 why deep question where it's like if you write your original why, then you ask, well, why is that important? And then you write why and you kind of go deeper and deeper until you have asked that around 5 times. Okay? And then we're going to talk a little bit about it after.
Make sure it's coming from like you and what you want to do.
Yeah.
Because like, I think Jeffrey, you're saying like, comparing yourself to others, right? I can tell you when me and Dalton were in school, we were very much like, we don't think we're going to do that much manual therapy or like exercise or, you know, modalities, right? That's just kind of how we felt, where we were skewed towards. And that wasn't necessarily the prevailing norm, you know? So you got to be, and you know, we're doing our thing now. We don't have an ultrasound machine in the clinic, right? And we haven't gone broke yet. So the key is like, focus on what your why is. Right? If it's to do with climbing, that's okay. Like go for it, right? Go down that rabbit hole. That's all I'll say.
Yeah.
Feel free to like use the ledges.
You can just use the ledges.
Yeah.
We'll take about 5 minutes. Will and I will kind of walk around too and just see how you guys are doing. This isn't going to be graded. This isn't going to go towards you graduating physio school. So like, don't feel like.
You need sources?
Yeah, you don't need sources. Yeah, go for it.
Yeah, so I started, my first level was like, overall I became a physio because I want to help people like stay active or get active if they're not doing any sort of activity currently. And then why? Because so they can stay healthy to do activities in their life that are important to them. And like I was talking about, like for me it's running, and like I like that as my next thing is like about a social thing, like hanging out with friends, or like I was on the cross country team in high school, so that was important to me. And just like mental health for like stress relief reasons. So I feel like whatever that person's activity is, like helping them be able to stay involved in that kind of overall to maintain mental health and just like actually enjoy what they're doing in life.
Mm-hmm. Yeah, that's great.
There's so much there. Like, I think what will be interesting, because to use this, right? We were kind of talking about it. It's like you want something that you can come back to as like a compass. Like, oh, am I going the right direction? Am I doing things the right way? Let's say 3 years from now, you're like, you look back at that and you look at your career and you're just like burnt out. And you're like, I'm like grinding out. I'm not taking care of my mental health. Things are going. It's like, based on that, you need to change something, right? Because this career shouldn't grind you to a pulp, right?
We actually had to make like an action plan for our program, like as an assignment.
Cool.
Things I put on there is like join a running group when I move home and like
Nice.
maintain that aspect of my life.
Yeah,
It's not
absolutely.
Like a career thing, but
Absolutely.
Yeah.
My starting one was to have other people see the same value I see in being active. And that's because like I've had so many of my like positive memories and connections in my life come from activity. And then it kind of came down to similar things like that Emily had of like, it's like where my health and well-being mentally and physically come from.
Mm.
Makes sense.
Yeah, sure.
Cool. Like we were kind of talking about with that, like it's interesting. I think hers were almost like less like of a hierarchy and more like some of the sentences sort of complemented. And I was like, there's no right way to do this necessarily. And one thing you could do if you're having trouble kind of going like deeper is like write more of a statement, you know, that kind of encompasses everything, right? Because it's just for you, it's your anchor and your compass. There's no right or wrong way to do it per se. But I think there was something in that first statement that probably should be there, you know, even though it's at the top, right? Yeah.
For sure.
Yeah, so for me, the first thing was like I want to help people be able to do the things they want to do in their lives without being limited by their own bodies. And then just following deeper over that is just because I have family members who, like, my mom has knee OA, osteoporosis, and then I think my grandparents have some health issues too, so they haven't been able to do like everything that they would have wanted to do. And I think it's like I don't want to hear like I can't do this because of my body, or I can't do this because I'm getting older. I want them to feel like I want them to feel like empowered and being able to do everything that they want to do like in their lives without being kind of impaired by their own bodies.
Yeah, that's awesome. I love it.
That's beautiful, man. Like, thanks for sharing that. Obviously, a little bit personal, but like you can see how like it should be, right? Because you know, I'm not going to like assume, but let's say they've been treated maybe in ways that weren't that. It's like that's a powerful driver for you to, you know, give people hope or like help shift their mindset. Like that may be something that's like powerful in your why, right? It's like helping people have that mindset because of like this, right? So make it stronger and stronger.
Those are really good. I don't want to show it.
You don't have to.
You don't have to. We'll bug you for something else.
You can share in another one.
Yeah.
It was similar to it, so I found it
Cool.
like quality of life, why, to help people be more productive, to help them be able to do more, to help them be able to achieve their goals. And then it came down like that's the experience of life, to be able to do
Yeah.
Cool.
the things you want ideally and feel good about them.
Yeah. Yeah, for sure. I love it. Cool. So now that you guys have like a little bit of the why, and that's always going to be refined, right, over time, and as you go through the rest of, you know, school and into your career. The second thing we're going to talk about is values. So what values drive you, right? And so, you know, again, we've talked about this a lot. You've probably heard of this a lot, is like you need to know your values, or companies talk about values and they have them up on the wall and there are things that like drive you. Like we think this is a very important thing to establish, but it needs to be something that's meaningful to you, right? So what we're going to go through in this next phase is we're going to have you list off 10 values that are important to you as a person, or as a clinician. And a lot of those things you'll find like intertwine, right? So like, you know, one of the standards here at the movement is like to communicate with clarity. So, you know, that's something that is important clinically, but for like Will and I in our lives, it's something that is very important and valuable to us. Or embody a healthy lifestyle is another standard that we have here at the movement. That's very important to us as individuals, but it's also a clinical thing that we think is very valuable. So there's a lot of crossover between that, right? So what you're going to do is you're going to list off 10 values that you think align with you as a clinician or a person, and then we're going to kind of refine those. If you are having trouble like coming up with values, like a lot of times I like to have people think about someone that you admire or look up to, whether it's a mentor, family member, whatever, and what type of qualities or values do you admire in that individual? And you can write those down as well if you're having a hard time thinking of like values that are meaningful to you. Okay. Again, no right or wrong answers here. Just try and get at least 10 down, and then we'll work off of that. Okay.
They can be like sentences too. They don't necessarily have to be like one word values.
Let's come back and like share some of your values. We can kind of just have, why don't we start here this time? Yeah.
I put honesty and candor.
Yeah.
Compassion, sympathy, activity. So activity, number 5 is things that energize you.
Things that
So
energize
working at things that bring energy in life, things that consume your energy.
Yeah.
Good balance and things that give you energy.
Yep.
Excellence, so setting high standards for
Yep.
things. Commitment, adaptability, kindness, and ambition.
Nice. Great.
So this is something that you're going to use, right? So let's go into a tangible example with one of your values. So honesty, right? How does that show up in like what you do? So that could be like, let's say, you know, you don't know everything, right? I don't think.
No.
So
Far from it.
can you be honest in a way that is good, being a good communicator with your clients about what you do and what you don't know, right? So that's honesty. And so when you're judging, am I, you know, practicing well in the way I want to, you judge it based off of that because that's an important value that you have. Does that make sense? So it's a different measuring stick than like, did I do that special test perfect? It's like, okay, sure, but like we all know how murky those waters are, right? But it'd be so awesome if you could be like, hey, here's what I know about your case and what factors are contributing to this taking a little bit longer versus a little bit shorter time frame. Here's things that we don't know about this. Here's what we might want to explore going forward, right? That's honesty. And I think you could probably start doing that, right? So that's cool because you can start doing it right now. Yeah.
Anyone else want to share some of theirs? We'll have one more person share, and then we'll kind of go into the next part.
I put education and exercise first, time with patients, working with like-minded people, practicing what I preach, communication is clear and ongoing, work-life balance, honesty, if I don't know, I'll learn and find out, mentorship. A couple of them.
Yeah, those are great. Yep. Yeah, well, before we go into that, we'll go to the next step, and then I'll share a little bit more on some of my thoughts on that. So what we want you guys to do now is like take those 10, or if you got however many you got, and we want to try to refine them down to 5. So what you might see is there's some common themes that pop up, like kindness and being nice, right? Or like some things like that might be combined into one word or statement, right? So we want to try to refine those down to 5, or you want to pick the 5 that are the most meaningful to you out of that list that you've created. So try and see if you can shrink that down to 5 of them.
And you can refine those over time too.
Yeah.
It's like, you know, communication. Okay, well, what about communication? Right? It doesn't have to be like one word. Like we have communicate with clarity, right? So that can improve over time.
Let's see if you can get those down to the 5 most meaningful to you. All right. Do you have yours refined down? Let's go with yours, Kendra, just because you just said your 10. I'd be curious to hear like what 5 you ironed down to.
Communication, clear and ongoing, honesty with patients, education exercise first, collaboration with patients, and then practicing what I preach.
Nice. Cool. Sweet.
Love it.
Yeah. So what this does, and like, again, today's not meant to be the be all end all, right? Like you wrote these things down, right? Like our hopes is that you continue to think about these as you go on your next placement, or you go through physio school, or you go into your career, and see if you can kind of refine or shape them over time. But what is really important about this is Kendra has now 5 values that are very important to her by the sounds of it, as who she is and how she wants to show up as a clinician. That becomes your measuring stick for how you're showing up on a daily basis. So what happens a lot is we get tied up into outcomes of our clients. As our clients get better, that means we did a good job. When our clients don't get better, that means we're doing a bad job, which is not necessarily the case. There's a lot of uncertainties that go on in rehab that dictate outcomes, both in the positive and the negative. And it's not always a reflection of you as a clinician. And I think a lot of imposter syndrome and burnout comes from putting that on yourself as a clinician. What these values and standards do is it gives you a guiding star, a measuring stick as to how have you shown up. So if Kendra's working with someone and she shows up every day and she withholds those standards and she's continuing to do that over and over again, and her client does not end up getting better, well, there's probably other reasons for maybe why that's going on. And as long as Kendra's withholding those values and standards, then she can say she's done everything that she needs to as a clinician to be able to continue to provide this person with the best experience, right? Now, if Kendra isn't doing that and she's not withholding her standards and she's not educating and doing exercise first and she's not communicating with clarity, well, then you have the ability to reflect and be like, oh yeah, I didn't do that so well. So that's maybe why this client didn't have the best outcome as they could. I need to improve on these things, right? So it always gives you a measuring stick or something to fall back on, which is going to be really important for you guys as you move through your career, right? So the last phase is going to be discovering the qualities you admire and don't admire in a physio. So what we want you guys to do is think about what are some of the things that you admire in a high quality physio. So maybe this could be like a mentor of yours, this could be a preceptor that you've had, this could be someone you follow on Instagram. And then you also want to identify what are some qualities of the physio that you don't admire. And we want you guys to write those things down so that you have those things on your mind, because I've learned more about what I don't want or how I don't want to show up versus then how I do want to show up, right? So it's good to kind of explore both of those. So we have examples here where you can do it in written form, kind of like writing it as a sentence. So for example, I find myself uncomfortable by physios that think they have magic hands. I don't respect someone who thinks they know everything and is unwilling to accept that they make mistakes. I'm comfortable as someone who thinks that they can fix everyone. So you can kind of get the example, right? So we want you to think about that for what are the qualities you admire, and then write down some of the qualities that you don't admire, okay? And that'll be the last step in the process here. Break.
One of the ones I put was advocating for what your patient needs, regardless of whether maybe the system is kind of limiting you, but really putting in the effort to do the extra things to get that stuff.
I love that. That's really great. Yeah, that's important. That's something that all of you guys are gonna really need to do in your career. Unfortunately, but it does. I mean, one of the things that I think is the best about being a physio is you get the opportunity to spend a lot of time with people to be able to do that. And a lot of people get caught up in the system and they don't get advocated for. So that's great. That's a really important one. Yeah.
And that can be something we've had situations where, we've identified something or think something's going on. And for example, the doctor doesn't want to get imaging. And it's there's no amount of extra knowledge that's helping you in this situation. It's more how much are you willing to advocate for that client to get that imaging, meaning you got to keep being on that doctor's office to do it, explaining why. And I know in this particular circumstance it was definitely warranted, and that's something where that's so important, just advocating for your client. Because Dalton said, you have so much time with them and have a skill set that, other professionals don't necessarily have.
Yeah. Let's do a quality that you don't admire. Anyone have one?
I don't admire physios who kind of make patients fear their own body or fear moving, they tell them that their body's broken or misaligned. Just all that fear mongering towards patients.
Yeah, words are powerful. They work in both ways. So you can use your words to be very supportive of your client and advocate for them, but that also can do a lot to harm them if you're not careful. And yeah, so I think that's a great quality to not admire.
And all this, you can see how it's all starting to kind of come together, right? Because it's like, oh, communication or like compassion or, you know, and then combining with the fact that you don't like when people instill fear in people, right? So all these things are sort of related and intermingled, and I think is a good North Star for you and how you're practicing. It's like, those are the things you need to be auditing with yourself. But yeah, I kept thinking I was going to say more and then realized I didn't have anything else to say.
Yeah, so what we want you guys to do with this is you now putting it all together, kind of like what Will was talking about. And so you are creating your super physio now, right? You take each of these steps and you put them together to create your super physio. So you have your why written down, you have your values, you have the qualities that you admire, you have the qualities that you don't admire, and these are what make up your super physio, and that becomes your guiding light or framework for how you move through your career. And you're always reflecting on, okay, how am I showing up in clinic or on placement or as a student right now, and does that align with what I believe, the values, the whys, the qualities that I admire in a physio, and that can really help you keep on track. And now what you're doing is you're very sure that communication is a very important value to you. Well, when you get out of school, you're going to go and take a communication course to improve your ability to communicate with people. That makes sense, right? That makes sense for you. Going and taking Mulligan 6 doesn't make sense for you, right? Because you're not just taking a course for no reason, right? So that is why this is important, because now you can make decisions as to what courses you want to take or what clinics you want to pursue or what type of people you want to work with, right? And you're aligning that, which is going to result, one, in you having a more fulfilling career, and two, it's going to result in you probably having hopefully less burnout, right? Because a lot of times people get caught in situations where they're doing a job that they don't really like. They can't display any of these values or these qualities because the clinic isn't set up to do that, or the system isn't set up to do that, and then you're treating people in a way that you don't want to be treating, and that is probably the most uncomfortable or worst things that you can get caught up in. And I think a lot of people get caught up in that. And so this is something you can take with you and be utilizing and using as you move through the rest of your placement, rest of school, into like starting your career.
It may lead you to like making some different decisions than you thought, you know, like it could be like a course that you take has nothing to do with physio. It's not even in the same field, right? Because that's actually going to drive some of those things forward, like some type of communication thing or some type of coaching thing, because you really want to help those types of people, right? So, or it could be going and participating in something that like a run club or whatever, or some other activity you've never been involved with, because that ties into all of this, right? So, you know, there's more that can kind of enhance your confidence and reassurance of how you are than just taking another, you know, manual therapy course or.
And it's any course. Like we pick a lot on manual therapy, right? Like, or that kind of stuff. But like, it's the same thing if you're taking an exercise course with no, like an exercise prescription course with no reasoning as to why you're taking it. It doesn't matter that you're taking it, because like, what is that going to do for you, right? Like, or you're trying to learn like some type of, it can be any course that you take that doesn't make sense for you. It's not gonna get you anywhere, right? So I think the same thing can happen with like the exercise prescription space, just as much as manual therapy. Like we pick a little bit more on manual therapy because like it's just like what people do, and a lot of times you get caught in that, right? And like you guys see it, I'm sure you've seen it before, and like again, it's not to say that there isn't beneficial courses out there from a manual therapy perspective, but the question is asking why and how does this align with what I do, and does it make sense to the type of clinician that I want to be? If it does, great, take that course. If it doesn't, I wouldn't take the course, because what's the point, right? Those are the things that we're trying to help you guys understand, is like how you make those decisions, right? But yeah, that's it. Like you guys can take, obviously you're gonna take these papers away. Like I encourage you to keep them, reflect on them, see if you can refine them, see if there's more things you wanna add over time. But we'll kind of open up the floor for you guys to ask any questions if you have any questions.
Yeah, we're just gonna hang out.
And then, we can answer any questions if you guys have anything on your mind.
Is that helpful? Yeah?
Cool.
Tell all your other classmates and then we'll set something else up.
Yeah.
Do it again.
Tell them you got great pens. And now everyone's going to be like, where did you get those cool pens? And you're going to be like, well, I got them from the movement at the How to Overcome Imposter Syndrome seminar that you guys missed. So.
Send us the videos.
Yeah.
Tag the program.
Yeah, for sure. Yeah.
You guys can ask us questions about like the clinic too. Or
yeah, if you guys have any questions, whatever you want.
Journey or,
yeah.
Whatever it is, we're just going to hang out.
Yeah, you gotta head out. Yeah, no problem. Thanks for coming.
See ya. Yeah, thanks for coming.
Thanks for having me.
I said I had a question in my mind and disappeared.
No worries.
If you're like, we're kind of heading into the time frame of like looking for jobs, do you have any advice in terms of like the types of questions you would ask to kind of get the vibe, I guess is maybe the word of the clinics that you're looking at?
Well, I think like based off of what we just did, like you want to dive into that kind of stuff, right? Yeah. Like not just like the kind of classic stuff like fee split, hours. It's like deeper than that. Like what are their values? What do they think is important? What sort of separates them from other people? What approach do they take? How do they enforce that with their, like, you want to know, am I going to go into a situation where they're going to make me practice a certain way that I don't want to, right? Or do they even care about their culture or like, like you want to know about that stuff, right? I think that's something that maybe people don't think about because you want to align like value-wise.
And I'd always go and try and like shadow the clinic or spend some time like interacting with the team there, right? And see how do people communicate to each other? How do they treat each other? What do they do in between sessions? Like what's the vibe like between the front desk and the clinician? Like those are things that I was always looking for. Like I'm also looking at like, okay, how much time do they get with each client? And like what are the other clinicians? How are they communicating to their clients? And how do they communicate with me as like someone who's shadowing there? Like you can learn a lot about a clinic's values and their culture by just stepping in and shadowing. So as much as like as a business owner and someone who's hiring clinicians, as much as I want to see you guys interact with people and how do you communicate with me or with our team or with our front desk or with our clients when you're in here shadowing, like you should be watching how do I communicate to Will or how do I communicate to Lauren, our front desk manager, or how do I communicate to my clients? Because that's going to tell you a lot about what the day-to-day interactions look like. And I think that's like super important to when you're trying to pick a job that makes sense for you, right?
We talked a bit about like communicating honestly with patients while like not like kind of balancing that with like them not thinking you're incompetent, if that makes sense. Like how that's, I mean, opening a can of worms, I think, but something I think I struggle with in situations with patients.
Yeah, it's hard.
That's a can of worms.
Yeah.
I know. I'm sorry.
No, I mean, like, it's a good can of worms, right? 'Cause I think it's like something that we all deal with.
Yeah.
And I don't know that I can like, that either of us can give like a perfect answer, but I think something that we've done is like, you communicate what you do know, right? Because and I think I find this with like, when people try to like prognosticate, like something we talk about in our mentorship is like giving someone a treatment plan. And like part of that is like telling them like how kind of long you expect them to be. And that is really challenging, but there's a lot of stuff you probably do know, right? Like let's say a tendon problem. Is that going to take 3 weeks to get better likely? No. Probably not, right? It's probably going to take some time. It may have some ups and downs, right? So like you know these things. You know it's probably going to be in this time scale of months, most likely, right? So like what you're doing is you're communicating that there's some uncertainty. Like, yeah, everybody's a bit different. We also don't know exactly how you're going to respond, right? But here's what we do know about tendon pain. Here's some things that likely you should be doing right now, right? Like it's explaining it in a way that helps them understand and shows your knowledge, but you're not claiming that you are like on April 7th, you know?
That's what I started with. We were like, what day am I going to be better?
Yeah.
It's like communicating that in a way that still like keeps them being like, okay, like I'm confident that I will be getting better within a decent time frame. Or like,
Exactly.
okay.
I think that's like the honesty and communication,
Yeah.
you know?
And a lot of times, like what I've found is if you do, and we talk a lot about this in the mentorship because it's like super important, but if you do a really good job of understanding like where the client is at, where the client needs to get to in terms of like their goals or what they want to get back to, and you show them the process of how you're going to help them get there, and like you really make it clear as to like, okay, we use a 3-step process here, like here's the 3-step process we use that's going to get you from where you are now to where you want to go. And when people can see a plan and they can see a step-by-step manner on how they're going to get there, I've really find they don't care how that perfect date, unless there's something like around the base coming up, then like, okay, there's a little bit of crunch time and we need to have a conversation. But like most of the times people don't really like care as much as they make it out to care. I think a lot of times people are more concerned about that when they aren't shown a good plan and their questioning comes from uncertainty of what to do. But if you lay out a good plan and you're showing them how you're going to get there, that uncertainty is less for them, and they're not so obsessed with the fact that like, oh, is it going to be better in like 4 weeks? They're like, oh, I get this. This makes sense. I could see how it might take a bit of time. And then just always being honest with like, you know, if you don't know something, like if it's like, hey, they ask you about this technique or whatever and you don't know it, it's like, I'm always like, yeah, I've never really heard of that or explored that too much. Like, I would love to look into it and give you some feedback on it. You know, and sometimes I'll question them a little bit more on it, be like, hey, like, what do you know about it? Like, tell me more about it and see if they have any idea of it. And a lot of times those things are even just like, again, they're asking those questions out of not knowing, not because they know something that you don't know. And like, just trying to understand why they're asking you about that sometimes is like a way as well. Yeah.
So kind of on that note with like planning and communicating that with clients, how do you, like, I'm kind of thinking about going into physio wanting to maybe practice slightly different than what a lot of people like patient-wise think of as like classic physio with like, you know, the heat tens.
Yeah, welcome to our life, yeah.
So if you like, when you don't do that, how do you communicate that sort of like expectation setting almost? Like, do you do that off the start? Kind of be like, this is how I practice, and you be like, this is why, kind of thing?
Yeah, there's a lot to that as well. And like, these are good questions to be thinking about and asking. And like, I know I'm talking a lot about the mentorship, but it's like, that's what we talk about in the mentorship, because that's what we think is the most important thing for you as a new clinician to start to get better at, because that's the most challenging thing you're going to come up to. So there's a lot of what we do from a client experience standpoint, is what we call it, to really set ourselves up for success with that starts before someone even comes into our doors. Now that's a whole nother thing that we could talk about, but like, to answer your question specifically, it's like, yeah, I would try as soon as possible to get on the same level as the client with expectations. And that's usually going to happen in the first assessment. If it hasn't already happened, which we implement things here specifically to already set that up to be the most success. So if you're working here as a clinician, like the person that's coming in to see you, the likelihood of their expectations of what they're going to receive from you as a clinician and what they want are going to be not drastically like spread out. They're going to be pretty aligned, right? But it's important to have those conversations as quickly as possible in a way that makes sense. Because if that person isn't willing to open their mind to doing that or whatever, that they're better off being referred out than like trying to work with you, right?
So I'm kind of thinking about like, I feel like it would fit well in your consent, like introduction spiel, like my name's Emily, physio, let's do like whatever, and then kind of explaining like, this is what I'm using in my practice, and like we can talk more about it as we go through, but I like the idea of doing it even before that. Like,
and there's like a more natural, like we share a little bit more of like a natural way where that conversation can come up, and like it really shows up when you start hearing just how the client's talking and what they're asking and their past experience with physio, and that's going to start to have you start to see things that will either be like, okay, this person really makes sense, or there's a little bit of a misalignment here. How can we come together and make this something that makes sense, or how do we get this person in front of the right person? But like we go one step further, and like we have how we put what we put on our website, how we communicate through our social medias, how Lauren, who calls every client before they come in for an initial assessment, has a conversation on the phone with them about expectations. Like we really try to do as much of that as we can prior to the client even coming in. And for you, as someone who might be working for a clinic that might not do that, there are still things that you can do to best set yourself up for success as an individual clinician within a clinic that might not do that. And we talk a lot about that in the mentorship. Yeah.
I think like it's a loaded word or combination of words, but like setting expectations is like one of the most important and hardest things that you can work on.
Yeah.
Overall. Like there's many facets and times that you should be doing that. We should be doing it often, and like probably around that type of stuff. What's today's session gonna look like?
The better you can get at that, and the more comfortable you can get at setting those expectations and being okay with someone not aligning with those expectations is an important skill to develop. And it takes time, because it's weird, it's awkward, it's not an easy conversation to navigate when someone's coming in with this idea of like, I want all of this treatment, and you're like, well, I don't even have an ultrasound machine in the clinic, like how are we gonna go about this conversation, right? Like that's a very uncomfortable situation, but those are the skills that you need to develop as a clinician to have success, right? And we talk a lot about how you can get better at that.
Or else you just cave, and you just do it, and you're like, is that really like?
And you'll see that
you got into.
You'll see that happen a lot, right? Like
You'll
see clinics that like are still doing things where you're like, why are we doing this? Like we're doing this because like this is what people think that they want, but like, what is this really actually doing to get the client back to running around the bay? Probably not a lot, but we're kind of caving to that in a sense, because the tough conversation of being like, hey, ultrasound is not what you need, but we need to load the tendon, and you need to do that through this type of exercise or whatever, and that person might not necessarily be on board with that. That conversation is really hard, and I don't think we have those conversations enough sometimes.
I don't believe that it can't be done, because our clinic is living proof that it can't. If you have the right conversations and approach, you can practice like that, and people will still do it and benefit from it.
Yeah, and it takes more, like why we're so passionate about this is it takes more of you guys coming out of school pushing that, right? Because if you're showing up to a clinic and you're trying to practice the way that we just talked about, and you're doing that and you're helping people, and people are getting better, and more people are coming to see you because you're helping people get back to running, people have, like clinics or other clinicians or the profession itself has to take note to that, and it raises the standard of how we approach things. But if we don't lean into that and we just kind of continue to do some of the same things that we do that really doesn't make maybe that much sense, then we're never going to have the change that like we all want to see in a positive way, right? It's no knock on like how things were done before. It's like, but once we start building on those things, like we always want to try to make the profession better, right? And so we want to push it forward, and we can take what we've learned and then we can add on to it, right? And we need that. Cool. Anything else? Cool.
Give you my before you leave. Yeah. You can connect with us.
Yeah. So we, if you guys aren't listening, like we have a podcast, PT Coffee Cast. If you haven't checked it out, check it out.
I'm a big fan.
Great.
Nice.
That's
right.
Undergrad, I love it.
Oh, that makes me happy, because like, so we put a ton of free.
Huge fan.
PT Coffee Cast.
PT
Coffee Cast.
Yeah, so we put out a ton of free content there. Like a lot of the stuff that we put out on the mentorship, or we put out on the podcast is like literally our mentorship. So like, if you want to learn a little bit more about some of the stuff that we talk about in the mentorship, what we do, that kind of thing, like definitely go check that out. Our Instagram page for the podcast is, and the mentorship is at the PT Coffee Cast, but we also have like our main Instagram page that we have here that we put out a lot of free content. So like we're always putting out stuff for new grads, students, and then feel free to like reach out with any questions ever. And then if you are, I know you guys are kind of wrapping up school and like eventually heading into practice sooner than later, consider the mentorship, because I think it's like a really good time to start working on these things, even if it is early in your practice, because a lot of the stuff that we talk about is very transferable to being a new grad and trying to navigate that crazy world. Yeah, no problem. Yeah, it was great.
Yeah, glad you guys could come out.